You are loved when it's considering getting on methadone, and you have a lot of questions. Let's talk about some common myths. Some people think methadone is just replacing one drug for another, that the person's just trying to get high again, but that's not how it works. Methadone is taken in a controlled environment, and when someone begins treatment, their dose is gradually increased over several weeks. The goal isn't to get high, it's to stabilize the bodies and reduce cravings. A person must see a doctor every week, and the doctor must see symptoms of withdrawal before increasing their dose. As the dose goes up, ideally, they want to see use start to come down. When someone uses large amounts of opioids like fentanyl or heroin or oxycontin, the brain adapts. Your brain actually doesn't want to be high. It wants to maintain homeostasis. The opioid receptors in the brain become downregulated over a period of time to reduce excitability to the presence of opioids, meaning there are fewer active receptor sites available for the drug to bind to. And this is how it tries to maintain homeostasis. Opioids lower a person's excitability, and so your body raises its own natural excitability in order to kind of average out. And over time, this creates a new baseline to accommodate the constant presence of the drug. When the drug is suddenly removed, the body struggles and is trying to maintain homeostasis, and it spikes up, which results in withdrawal like muscle aches, sweating, nausea, diarrhea, just general irritability. Your body's agitated because it's trying to maintain, because it's in a natural homeostasis where it's higher level, and with the absence of the opioid, it spikes up, trying to maintain homeostasis. Methadone works by safely occupying those receptor sites and helping the body regain homeostasis. On the right dose, it doesn't produce a high. Instead, it allows the brain and body to function normally again. So methadone isn't about replacing one high for another. It's about stabilizing the body, reducing harm, and supporting recovery. There's another common myth that methadone eats your bones. While studies show a correlation between methadone use and lower bone density, it's important to understand that correlation does not mean causation. People starting medicated assisted treatment often come from a background of poor health. Years of opioid use, poor nutrition, and neglecting healthcare can all contribute to lower bone density before treatment even begins. A study by Gray and colleagues looked at 83 participants, 48 men and 35 women, to examine methadone's effects on bone health. They found that men on methadone had about 10% lower bone density compared to control groups, but women's bone density wasn't affected by the methadone, or wasn't affected. One reason for this is that in men is that methadone can lower testosterone levels, and lower testosterone can lead to weaker bones. Vitamin D is also a key factor in bone health. In a study by Kim and colleagues, 52% of the 93 methadone participants were found to have low vitamin D, but only 2 participants knew about it. Low vitamin D can contribute to osteoporosis and increase the risk of fractures, muscle aches, weakness, and it can cause chronic pain. So while methadone has been linked to bone health issues, it's not the sole cause. Poor nutrition, low vitamin D, and other health factors play a major role. Addressing these underlying issues through nutrition, supplementation, and regular health care can help protect bone health while on methadone. There's also a comment that you should keep your methadone dose low so that it's easier to taper off of. The truth is, keeping your dose too low can actually make recovery way harder. When the dose is too low, cravings persist and people may continue to use illicit opioids. This prevents your body and brain from stabilizing. Your body needs the dose it needs for stability, and that's okay. Experts recommend stabilizing on the proper dose and abstaining from illicit opioids for at least 2 years before attempting to taper off. According to Therapeutic Health Services, 89% of people who taper off before 2 years end up relapsing to their drug of choice. The reason for this is neurochemistry. Once your brain chemistry stabilizes on the correct dose, you can start engaging in activities that promote the natural release of dopamine, like exercise, hobbies, and social connections. Establishing these recovery routines and changing behaviors lower the risk of returning to use. So the methadone stabilizes your neurochemistry so you have the freedom to engage in activities that promote the natural release of dopamine, because dopamine tells us that something is good for our survival. So the focus should be on stabilizing, building healthy habits, and supporting your recovery, not rushing to taper. A proper dose is a tool for recovery, not a crutch.